So we want to talk here about suction catheters, especially these suction catheters. So these are usually considered single use. So how do we extend the life of these? Before we start doing anything with it, I'm going to put on gloves. These are 2 tubs that I happen to have, and I filled this one with soapy water, and this is just with nice clean water. That's it. If you don't have tubs, if you have pails, if you have smaller Tupperware containers, even a sink, as long as you clean the sink really well first. And what I want to do is the easiest way to clean the inside of this is to use the suction itself on it. So I've got my suction line here. And you are now ready to clean this catheter. We're connected to our suction regulator, so the easiest way to clean the inside is to just suction the soapy water right through the catheter itself, because that'll clean the lumen. And if you view the lumen and you can still see it's dirty inside, then just pull a little more soapy water through it until it's clean. And if you have to do it 4 or 5 times, that's okay. That's what it's for. So now I can see the soiling on the inside looks good. And if you're not sure, because there's soiling on the outside, just stick it in the soapy water. Just gently, I'm not applying any suction now. I'm just letting it rest in the soapy water, just swishing it around. Now I've got the outside clean. If I can see that there remains a little bit of soiling inside, again, just repeat the procedure until it looks nice and clean. This now has soapy water on the inside and the outside, so we are going to move on to the nice, fresh, clean water. So now I'm swishing around the outside of the catheter to make sure that any soap that's on it is being removed. I'm just gently rubbing it with my gloved hand to again ensure that all the soap is off. And then again, at least 2 or 3 times, just for short periods, make sure you suction to remove any soap that's on the inside of the catheter. Okay? Now I'm just applying suction again to try and get any water that remains in the tubing to evacuate back to the collection chamber. And I am done with that catheter. And now I'm just putting on a nice fresh towel where we will let it dry for until it's thoroughly dry. Now, we want to cover one other type of suction catheter, and this one is very particular, okay? So this one is a closed suction catheter. With a closed suction catheter, if we immerse this in water, this becomes sticky and non-usable. So the easiest way to maintain it is right while it's connected to the trach, when you finish suctioning, to add a little bit of sterile water, this needs to be sterile water or normal saline, to this port. If you have those little saline bullets or sterile water bullets that you can do through there, that's the best. But what if you're out in this unique situation? You may do the following, and that is, again, connect it to the suction port, and then only the tip of the catheter is placed into the soapy water. Again, I'm suctioning through to try and clean the inside, clean the outside. Notice I've never immersed this at all. I only did the very tip of the catheter is in the water. And so I'm massaging it. I'm applying a little bit of a suction. And then when it looks clean, moving on, doing the same thing in the clean water. But never getting this area wet. All of that is still dry and needs to be maintained dry. And then, because we don't want to get it wet inside, we suction first, make sure we get any fluid that's inside the catheter out, and then just leaving that exposed to dry. And when they're both dry, then you would just stick them inside a Ziploc bag or another Tupperware container to hold it for when it's next needed.